Hi, my name is Melissa. I'm a surgical assistant here at Drs. Tom and Mark McCawley's office, and I'm going to go over some post-operative instructions with you regarding our gingival graft procedure. The purpose of a gingival graft is to stop your recession and thinness of your current gingival tissue. We're trying to make your gums very thick and robust, so that way we prevent further recession. Gingival graft is not intended to cover up the root. You will be given a care package that day with all the essentials inside to care for your gingival graft area. Don't forget to take any pre-medications that have been prescribed to you, and please follow all directions as noted on the medications. The first day of your procedure, when you go home, you are allowed to brush your teeth. Use the soft surgical toothbrush that we provided for you in your care package. You only want to be brushing the biting surfaces of the teeth only where the graft was performed. You can brush everywhere else if we did not perform the gingival graft in your other teeth with your regular toothbrush. The area where the graft is primarily going to be on the facial. You are allowed to brush the top of the teeth, and you are also allowed to brush behind the teeth, but do not brush along the gum line. You must perform this for an entire week. On the second week, with the brushing, you may gently use a rolling motion along the gum line and start brushing gently along the gum line. You still have to perform the same brushing techniques as brushing the tops of the teeth and behind the teeth. Always be using the chlorhexidine spray solution or the chlorhexidine mouth solution if you were prescribed a bottle twice a day. You want to either spray it or do a full mouth rinse twice a day and leave it on there for about 15 to 20 minutes before you eat or drink anything. Flossing. You are not allowed to floss the gingival graft area for an entire week. You may floss your other teeth, and I encourage you to practice good plaque control so that way you don't infect the grafting area, but you are not allowed to floss the graft area for an entire week. Once the 1 week has passed onto the second week, you can gently floss the gum graft area, but do not snap the floss down into the gum tissue. Once the third week has passed, you can gently floss regularly, but just be gentle in that area. I'm going to go over diet. For the first day, do not consume anything hot, as this will have more inflammation in the area and possibly cause more bleeding. You can have lukewarm to room temperature foods, and the foods must be soft. First day, I recommend liquid to a yogurt or pudding consistency, and then the next 6 days, I recommend really soft food. I do not recommend anything that is very acidic, that has anything lemon, a lot of spices, as this can irritate and sting the gingival graft and the donor tissue, which is from the hard palate. Which brings me to my next subject. The donor area is going to be from the hard palate. That's usually the area where it causes the most bleeding. If you suspect any kind of bleeding in the hard palate, please use the gauze that's provided for you in your care package. You're going to take one piece of gauze out and put it on the hard palate, and with your thumb, you are going to apply pressure with that gauze on the donor spot. You need to apply pressure for about 15 to 20 minutes, and that should alleviate any kind of bleeding. If the gingival graft area has any kind of bleeding for the first 24 hours, slight bleeding is very normal. Again, take a piece of the gauze and fold it in a rectangle and gently pull your lip out and put the gauze in between your lip and your gum and flip your lip over. You want to place pressure on the outside of the graft with your fingers for a minimum of 15 to 20 minutes. Ice will be provided for you in your care package, and it's a good idea to do ice for the first 72 hours to prevent any kind of swelling, and that will also alleviate any kind of bleeding as well. Be careful not to eat anything hard or crunchy, as it can nick the hard palate, but if it does, it is not the end of the world. It is okay. You can just do as I say and use the gauze and push your thumb up into the hard palate, and that will alleviate any kind of bleeding. Over the next few days, your graft tissue color will change, and this is normal. The first night and the first day, it's going to look very red and bruised and slight purple. The next couple of days, it's going to form a white color. Because we don't form a scab in the mouth, the gingival graft will actually look a little white. That means that it's healing. After a few days have passed, the whiteness will turn into pink, and then the pink will turn into a nice coral pink color, and it will match your gingiva color perfectly. If you have any questions or concerns, please do not hesitate to call our office.